It impacts diagnosis dramatically to understand whether the cell of origin is unmutated or mutated. That's really critical, I think, and many patients want to know which subset they belong to, so we must give them that information. But it also helps clinicians to consider their approach to the disease. Within mutated CLL, it's particularly important because there are some cases which are not so benign, which need treatment within mutated CLL. So it's important to understand which those are, and there are various features of mutated CLL cases which will help the clinicians to understand how aggressive that disease is likely to be, and also how well it might respond to chemotherapy. For example, mutated CLL seems to respond very well to so-called FCR therapy. And in fact, some patients are being cured, inverted commas, if you're ever cured of a tumor, by that approach. So it definitely impacts on the kind of therapies that can be given. The therapies that target the B-cell receptor, of course, are being used in unmutated CLL as well, very strongly, and are giving good remission, but resistance will develop and is developing. So we need to understand more about those resistance mechanisms. But there is also another therapy which is developing, which is Venetoclax, which targets the upregulated BCL2 molecule, which is the anti-apoptotic molecule expressed in CLL. And therapy now is targeting both BCL2 and the B-cell receptor and other molecules on the cell surface. So we'll wait and see from the clinical trial results which give the best results for the patients.